If you're in your 40s or 50s and dealing with heavy periods, clotting, or even ovarian cysts, we're going to dig into why this may be happening and what most doctors won't tell you. But before we dive in, please know that heavy periods and pelvic symptoms can sometimes be caused by endometriosis, which is a different condition altogether and really does deserve its own conversation. So maybe I'll do a separate episode in the future on that. So today I'm focusing on the most common perimenopausal drivers that we see clinically. That's going to be low progesterone, estrogen metabolism issues, nutritional deficiencies, chronic stress, and how to support your body with proper HRT, minerals, detox, and so on. So first, you should know heavy periods, clotting, and fibroids often go hand in hand because of a common root problem. Unopposed estrogen. You've heard me say it many, many times. This means that you don't have enough progesterone on board to counterbalance estrogen. Progesterone tells the uterine lining that it's okay to shed, and it prevents excessive thickening of that uterine lining. So when the lining is too thick and shedding poorly, you're going to get those clots. These clots that you're seeing in your underwear or on a menstrual pad, that is a clear sign of imbalance. Please don't ignore it. It's also a risk for low iron. So refer to the show notes because I did a whole episode all about iron a couple of weeks ago because a lot of people are confused about iron. There's a lot of doctors and providers that are wrongly addressing it. So just taking a supplement is really not addressing the issue. There's more to the story, as always, right? When it comes to health, it's so complex. We try to simplify it here. Okay, the other thing to think about is poor estrogen metabolism. That could be due to genetics, poor methylation, gut or detox issues, or mineral deficiencies. Estrogen can get recirculated and cause more stimulation. So on that note, fibroids grow in response to estrogen. I'm not saying that estrogen causes them, but again, when you have that unopposed estrogen because you don't have enough progesterone to counterbalance estrogen stimulatory effects, that's when growths can occur. And in perimenopause, estrogen can be really erratic. It can be really high, it can be low at times, but those highs can be problematic, again, because you don't have enough progesterone to counterbalance it. Another thing to consider is supporting iodine and overall mineral balance. Do I sound like a broken record when I talk about minerals? It's because they are that important and they are so overlooked by most providers. Now, I had mentioned cysts earlier, and you may have them, you may not. They are typically a normal part of ovulation, but if they're frequent, painful, or you have multiple cysts, PCOS may be involved. That's polycystic ovary syndrome or ovarian syndrome, which may warrant further investigation. That also is a topic on its own, which I may do a separate episode on. Now, if you are using estrogen hormone replacement therapy, you must have sufficient progesterone on board. Without it, you're just fueling the fire. Unfortunately, there are providers who don't know to give women progesterone, so you need to ask for it. Or they may start you on estrogen for a while and not really revisit progesterone, or they may wait to put you on it. And if they do, many providers will often use a very standard 100 milligram dose of oral micronized progesterone. I have found that it's rarely enough for women, especially if you're taking continuous estrogen. So typically dosing is going to be 200 to 400, sometimes more, depending on the woman, depending on your history, depending on your symptoms. We are all different. So don't be afraid to ask for higher doses of progesterone if you're dealing with some of these symptoms. Now, if you're dealing with these symptoms, some providers may suggest getting a vaginal or abdominal ultrasound to assess your endometrial lining, and they may do that before starting hormone therapy as well. Now, I'm not a doctor, obviously, but I don't know that it's absolutely necessary. I certainly didn't get an ultrasound before starting HRT. We don't typically recommend that to clients because it's one more thing that they have to do and worry about. But if you're experiencing the issues that I've been mentioning, it may be a good idea for you. I do actually have to schedule one myself at this point. I've been on HRT for years now, but I have recently been dealing with some occasional abdominal cramping, and my provider and I decided that it would be a good idea to get an ultrasound done just as a precaution. Now, some other things to consider that, again, your provider likely won't mention are things like detoxification. your liver, your gut, your kidneys. They are these systems that metabolize and clear out excess hormones. If those aren't working well, estrogen isn't going to leave the way it should. You're supposed to use it and lose it, and it can metabolize into unwanted forms. We have multiple estrogens, and some are better than others. Minerals, again, minerals are cofactors in those metabolic pathways. So things like magnesium, zinc, selenium, iodine, we need these to function optimally. That's where an HTMA, hair tissue mineral analysis, can really help to see what your body's mineral status actually is so that you know what you need to support. And then, of course, gut health. Gut health is critical. If you're not pooping daily, estrogen gets reabsorbed, and you need a balanced microbiome to metabolize these hormones. So here are a few takeaways. Evaluate your progesterone with your provider. Are you supporting it, meaning with bioidentical hormone replacement? If not, start there. I know there's a lot of people that say, oh, you can eat a certain way and you can use seeds or adaptogens to bring your progesterone levels up. When you're over 40, it is a different ball game. That stuff can help in your 20s and 30s, but once you're over 40, it is very difficult to get your progesterone up without the use of bioidentical hormones. Refer to the show notes for the topical cream that I do recommend if you don't have a provider yet to prescribe it, or if your provider isn't being cooperative. Now, if you're on progesterone, you may need to address, is the dose high enough? Are you using a form that works for you, right? There's topical, there's oral, there's other ways to get progesterone in. Some women do vaginal suppositories. Another takeaway, if you're using estrogen HRT, consider the dose may be too high, and or consider getting an ultrasound to check your lining. You also want to check your mineral status, use tools like an HTMA to see if your detox pathways are supported. We have open enrollment currently for the perimenopause method this month, so apply to work with us. And of course, you want to look at your diet, right? Are you eating enough protein and fiber? These things are really important to support detoxification. It gives you a lot of the nutrients that your body needs. Are you eliminating daily? Meaning, are you pooping every single day? Are you easily pooping, or are you dealing with constipation? Because if you're constipated, if you're skipping days, if you're straining, then you are not properly eliminating these excess hormones. Is your stress really high? That impacts your hormones too. How do you assess the toxins in your environment and your personal care products? All of this impacts your hormone metabolism. So if you're serious about making changes, you want guidance on all this, because I know it can be overwhelming. You're not an expert in this, right? This is what we do every single day. This is how we support clients in midlife. In the perimenopause method, we do advanced testing. We provide personalized plans, mineral balancing, gut support, and HRT guidance if needed. If you want to join or learn more, check out the link in the show notes. Thank you so much for being with me today. If this episode helped you, please do give me a thumbs up and leave a comment if you're watching on YouTube, or give us a review if you're on Apple or Spotify, because this education really does matter, and you and other women deserve relief and clarity. Until next time. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.